All right. Welcome to Practice Citizen Voice and Action IQA Orientation Implementation Quality Assessment. As a community of practice, we have been trying to increase the use of our IQA tools in two recent evaluations, one for AIM Health as well as one for CHNIS. Both evaluations came out saying we need to utilize these IQA tools more often, not only for um, use in planning our programs as well as advocacy. So today we are very excited to have Sue Kant, a subject matter expert in citizen voice and action. She's ready to walk us through the CVA implementation quality assessment so that we walk away knowing the essential elements of CVA. All right, with that introduction done, Sue, take it away.
Thanks so much, Sarah, and for the opportunity. And it's wonderful that this is actually evidence in practice, which is fantastic because we know, as you mentioned, from this very big child health nutrition study that, in fact, there were some lessons from the way that the comms implementation processes were carried out. That is, that once there were some implementation issues identified, and the comms advisor went in with the IQA tool, there appeared to be better implementation post the use of the tool. So from our perspective in the CVA team, we really haven't had an IQA until probably about 18 months ago. And I would just flag that it hasn't necessarily been tested from what we know. So we think it's just a on-the-shelf product not yet being used, and we need to work hard to socialise it. And this is a great platform. Thanks, Sarah, for doing that. Just overall, and we'll get into it shortly, but it's our tool. When we call it a tool, and we can debate around what the nature of quality assessment and assurance, but it is essentially a checklist. So it's a checklist of all the CVA processes that they've actually taken place, and then a scoring criteria to give an overall feel for how the level of implementation is going. So there's different definitions of quality is the point that I'm trying to make, and how you assess quality. I'll get into that in a minute. But why do an IQA? I think make sure efficacy is the number one reason we want to make sure that our programs work, and implementation is a big issue in terms of efficacy. Obviously, with CVA, we want to empower communities, and if we don't actually use the methodology correctly, and a key part of using the methodology correctly is ensuring that we give information to communities. We empower them with the information as well as other activities. So when I get on to the first step in the IQA process, if we don't, and this is just raising the point, that is fundamental in this area of social accountability practice, communities cannot engage with government without information. The next step is agency and empowerment, but information is absolutely foundational for them to be able to engage. So our CVA process could just stop right at the beginning if that is actually not done or done well. Accountability obviously is a key reason to do some quality assurance, stewardship to donors, and obviously our Christian mission. This is our primary and premier empowerment approach in the organisation, done over 700 programs in 48 countries, and getting escalating traction also among donors. But if we're really sincere about our Christian mission, then we should be trying to do it correctly, and this is one tool that we can try and ensure that. The idea of this session was also a discussion, so I'm really going to whip through just give a taster, really, based on the phases of CVA, which is the way we implement the methodology. We do a phase 1, 2, and 3, but I'll get to that in a moment. But the first step is preparation. So, as I said, the IQA, and I'll just flip to what it looks like, is related to organisation and staff. If you look down on the left-hand side, you'll see an essential element of doing CVA is that staff are organised and prepared, which goes without saying for any programming approach. But what you'll see on the right-hand side is essentially this is a check the box exercise, and that goes to the issue I've said about how we interpret and assess quality, but it's essentially to make sure these things are done. So the things that we want to see done, going back to the slide, we want to make sure that there is leadership buy-in, and this is really critical because CVA is actually inherently political. We are engaging citizens with government, and if our leaders, especially our national directors, do not understand this approach, we could have a risky situation on our hands. So we argue that before anything happens, we should have an orientation for all of the senior leaders, programming quality, advocacy, finance, and of course the national director and operations manager, so that they understand what CVA is all about. We have online courses, we have face-to-face training of practitioners, and we're really trying to reinforce the value of new curriculum that we've developed, so that we have an actual in-the-field training of practitioners. How do we use the methodology of the community, including live simulation with the community? And then we have a further TOT, which is about not understanding the methodology, but understanding knowledge processes by which we can get better learning about how to facilitate and train. How people learn is basically a focus of the training of trainers, how to have a better quality TOT through both information transmission and practice of the methodology, but also knowledge practices, better knowledge practices. One of the first steps in CVA is making sure that the advocacy staff and other staff are involved in a review of policy and government arrangements in the country as they relate to service delivery. And we've recently, we've had a CVA DME guidance pack since 2012, which has been revamped last year. But again, it's how do we get this operationalised? So prior to starting CVA, we obviously want to see some understanding about the complexity of the M&E challenges in this area of practice and some planning and a baseline. So I mentioned that there are 3 phases to CVA, and I'm going to share excerpts. I'll just whip back to the
I lost sound
scroll
too.
through.
Oh, there she
Yeah.
is.
Oh, okay. Sorry. So we're in phase 1, and what the IQA or the checklist, some of the key points it covers. And one of the very first and most important is that there are quality, accessible and visually appealing local materials for communities as part of the sharing of information about the way government works, service standards to improve service delivery, the representatives they have, their local members and the bureaucrats that are responsible for service delivery, the service providers. That is a contextualised process that the national offices undertake, but it is like the first step for CVA. If that doesn't happen, nothing else really follows. Some partner mapping, which is critical to all of our work, of course. And then the key community volunteers, the establishment of a group of community volunteers that are working very closely with the local governance mechanisms across the sectors, be the Parent-Teacher Association, School Management Committee, Health Committee. There are a couple of other things on that, but I'm just highlighting a few examples. In phase 2, we have the community gathering, which is where we use a range of participatory activities to engage community with the information that they've learnt in the previous phase of the program. So some of the things that we need to make sure are that there is this bringing everyone on board before these activities start, and particularly government. We're really reinforcing that government officials involved in this process really need to be well informed and engaged. Good planning and logistics for scorecards and the monitoring standards and the interface meeting, which are the key processes by which we engage the community beyond advocacy. And the methodology is sex and age disaggregated, because it's about ensuring the voice of community members that often don't have their voice heard. The interface meeting is a meeting between service users and providers, and we know from the evidence that we must have political and bureaucratic arms of government involved in the meeting for us to get the results that we need, because essentially this is about community lobbying for government accountability. So if government, both political and bureaucratic arms, are not in the room, we limit the efficacy. Now I'm jumping through to phase 3. I know, Christopher, you probably aren't very familiar with the CVA approach, but this is really a checklist of all the different activities that take place under CVA, as I said, through this phased approach. And the third phase is advocacy. And although I didn't highlight it, I'll just whip back to the previous. The community gathering ends with an action plan. So the third phase is about how do we monitor that, not World Vision, but the community, but how we support community to monitor the implementation of that action plan, and advocacy skills for them to then follow up to government if things haven't been done. So by way of example, in Bangladesh, we have a very big USAID program. It's probably our biggest global sectoral integration of CVA. And I was just speaking to the manager of that program yesterday, and we have already results where at the community clinics, we're working in 118 community clinics in Bangladesh under this program. We've had all of the meetings that I'm talking about, the scorecards, the interface meeting with service users and providers. And in those meetings, we had UP chairs, that's the local government head, who is a politician, and they have made commitments in those meetings. One of the big issues that was identified is the lack of water facilities at these community clinics. By the way, community clinics come under a policy of a signature policy of the Prime Minister of Bangladesh. So there's a lot of political will around it, but they haven't, the policy is there and the clinics are there and the staff are there, but there are many elements that are missing. And one of the key elements communities have highlighted is the absence of water access. So what we're seeing is that through the interface meetings and follow-up advocacy and the monitoring of these action plans, that the UP chairs, the local government heads, are committing in the meetings to do something about access. I've seen already in a large number, I have top of my head, that water tanks. So that's where I plans to then follow it up. Also, we have a database, an online database, where I'm more than happy to run you through an orientation at another time. But as you probably know, with participatory approaches, there's a lot of butcher paper used, and a lot of the data, which is community-owned data, is collated on manually. So what we do is we're developing an offline app for this, but we have a database that staff put the aggregate data in the database, which produces reports. So, for example, in the example, I'm just responding to your question, Sarah. So one of the issues with the database is getting understanding in the national offices that the CVA staff do not have the time to do all of the data input, and we really need some commitment by national officers to this database by either short-term consultants doing the data input. So, for example, in Bangladesh, we've been doing the CVA database has only been live for maybe 18 months or less, but in Bangladesh, we're doing CVA in 700 facilities. Now, that's just a catch-up process, but essentially we need some support, which is pretty easy. It's not that expensive. In fact, I've been talking with Holter in the US team about how we can get some funds from the US to support Bangladesh, just to hire someone just for a month or two. It's not a big deal, but it's basically just getting that data on those 700 facilities put into the database so we can start, then the staff can just update it very quickly because and then we can produce reports. But putting data in on 700 facilities is obviously beyond the job descriptions of many of the staff, and so it's this kind of who's responsible for doing it, and the national office to understand the benefit has been tricky. But what we're also in fantastic because okay, now Christopher, if I so I've stopped. We can prove the database concept through the Nova Jatra program. That's a $74 million DFSA, Christopher, for your background, multisectoral. Because what we've done is we've got a data person to input the data across, for example, the 118 community clinics, and we see this percentage of community clinics is not meeting the standard. This percentage is the graphs and the pie charts that show this data and put them into reports that can then be used in, actually we already have a health policy brief that's starting to use this data. So then citizens can also use that compiled data themselves to lobby in a more effective way to government. So I think that sort of really wraps up my overview of the IQA. It's really a taster, and what I would say is that we're very keen to get people in the know who understand assessment and quality assurance to take a look at this and see how it might be improved, or to see if we can get it tested out in the national offices. I think there is some additional work that we could think about. For example, I was at the American Evaluation Association conference last week. There's a very big Harvard study in this similar area, and they're actually doing assessments of whether communities received information. So not just did we give the information, but did the communities receive and understand the information before they then move to the next step. So there's always room for improvement, and it would be good to see if we can find some other supplementary tools to form part of the assessment. I'll finish up there. Sarah, we can have a broader conversation and let me know what we missed.
Sure. Just so I've done one of these, I've done two of our project models so far. I did one session for community committees and then this. And so what happens now in groups is we would open up to Q&A. So Chris, specifically, if you have some questions, go ahead and put it in the chat box. And this just got really big all of a sudden. Oh, there we go. And then what I think has been effective in other IQA orientations is throwing it back to the implementers who are on the call just to say, CVA, at what point in this checklist, what are the pain points in the checklist? Where are things breaking down?
Yeah.
Because one of the, also I guess a question I would have, a practical one, is as national offices take up utilization of this tool and they're using it and they're marking it off this checklist, I mean, should they be emailing it back to you? With health and nutrition, we've put together our implementer forms for COM, TTC, PD Hearth, and CMAM. Do you have something supposed to be reporting back feedback on what have been some of the pain points as they're looking at IQA and where it might be breaking down in the field for them, and where do they reach out for help? Is sort of some next step pieces that if you've got some answers for those, I would build that into this presentation for them, yeah, for the next hour.
That's a great idea. And one of the things I thought we should also just send out a quick survey to M&E teams. Have they heard of the CVA IQA? Because I'm sure there's an awareness issue that we have in terms of making sure it gets to people. And part of that is just a really a protocol issue sometimes in the organisation, because we don't have those direct relationships with National Office M&E teams, so we have to get those things facilitated through others. So, but I love the idea of implemented forms, and I think we probably need to develop those based on if you can share those with us, Sarah, or if I reach out to Michelle or Polly or whoever has
It's a
access to
for
that.
it's a forum where we come together about once a quarter per project model to talk about, how things are going in as implementers. And then we could say what have been the pain points, and then inevitably one of our subject matter experts are like, "Are you using the IQA? Tell me about what that's telling you about this time." I see Chris here wants to dig in a little bit more, yeah, into getting this data. People, when
Yeah,
we talk about CVA and talk about identifying local issues to improve, well, for our community of practice, health and nutrition services in the field, it's like the big thing is people are now wondering. In fact, when I was just at Health Systems Global Research Symposium, everybody says we might have all these local groups who are fixing things locally, but what's the mechanism to aggregate that and to raise the flag at the national level to say, okay, we're seeing this problem pop up in 40% of that, rolling up the issue from local to national systems is a big question people have.
and I think we should just advertise, because that's a great question, that we have what we believe is a really innovative partnership with CARE, who do very similar work and get very similar results to World Vision in Health from social accountability. So what we're doing with this partnership is we've got a technology partner to help us build a platform linked into the CVA database, is the hope, so that we can leverage multiple activities as you just described, and then leverage that information to lobby at the national level. So that is something that's really recently been introduced to WVUS. But post my trip, I'm planning to do monthly calls with the US office. Christopher, I'll include you on an email I'm going to send out, so that there's a lot happening. So we actually need to have regular calls and updates and newsletters to make sure that we get that buy-in and interest, and have those conversations.
Does your mobile application, the database, is it structured data so that people have to choose from a list of activities, so that as it's rolling up, we're comparing apples to apples, or is there a bunch of free text space where people might be describing multiple things, but it's the
Uh,
same thing multiple ways?
it's fairly structured, because basically what it's doing is replicating the templates for the methodology. But I do believe, and I can't talk to it in detail, but we've got a database analyst that can. I do believe there's some flexibility, and we are building in this access for partners. So we want to make it a much more, not open source, I don't think that's the right term, but accessible to others, potentially including governments. So the question is always about the dollars and how you, when you've got a customized database, how you make it do what you need it to do, but you make it also a bit more flexible and accessible to others. So that's part of the care process. In fact, we've just got agreement between the Chief of Party for Care and the Chief of Party for World Vision of these large DFSA programs that they want to try and pilot this care work, this care partnership. It's called Everyone Counts, by the way. That's the name of the partnership, Everyone Counts. And it's very much about how do we leverage citizen data for citizen lobbying to government? How do we bring together all this voice that you're talking about, all this feedback, to amplify it to government, which is where it's going to get more traction if it's a louder voice.
Yeah. Chris, I'll let you. So I don't know, Chris, if you've seen CVA being incorporated into any of the TB HIV grants that are going through Global Fund. Recently gone through all of our grant proposals to write up our capacity statement. So he's most familiar with where it might appear in our infectious disease Global Fund portfolio, if at all. Chris, do you have any other questions for Stu? What brought you, anything burning questions that brought you here to the session today? I know Chris is one of my learners. He's a faithful community of practice participant.
Thank you, Susan, for the presentation. I got interested.
Yes, we hear you very, very, very faintly. Can you turn your mic up?
Yeah, mic. Okay. Let me see what is happening. Okay, 1 minute.
No, you still sound like you are 10 blocks away.
Okay. Hello, can you hear me now?
Still very, very faint. I know.
Oh, what is this happening?
I feel like there's got to be a switch or something that got turned off on your headset or something.
A little bit by way of by way of we have been looking at how we integrate CVA in, and some of the vernacular I just okay. I'm here. I'm just seeing if Chris is going to
see if his laptop speakers work.
Yeah.
Okay. Yeah. How is it now?
Oh,
better.
Wow. Thank you.
Thank
you. Sorry. Anyway, okay, that went over. And thank you, Susan, for the presentation. And I got interested so much on the CVA and the IQA. Initially, I knew of LQA. We used to do something called lot quality assurance. As a name a new tool. And now IT implementation. That interested me. I like working with data, and that's why I have a question about the data. When you talked about working with 700 facilities, I know what kind of data that is. And I know how technology, especially mobile phone technology, has helped with data collection and even relaying data to a central point and all that. So, and thank you for answering my question and saying that you're already in the process of putting up an offline app, which is quite good. But I had an experience with CVA while I worked in a national office in Kenya. Probably you already have some work in Kenya working on with CVA. Can you hear me?
Yes, yes, loud and
Okay.
clear. Great to
Okay.
know that
Okay.
you were working in Kenya on CVA.
Yes. 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 And the communities were very excited about CVA, and they put their feet forward and did their voices and their advocacy and checking on what was happening in the government, until to a point where they also wanted to raise their voice on what World Vision was doing, and we allowed them to assess World Vision and raise their concerns about the implementation of World Vision. But where the problem was is when technical reports are done, and they are done in their technical using technical language, and communities, especially the illiterate or rural communities who have those reports, well, nice reports, but how do we disseminate to them? How do we allow the rural people interpret this data? I would like to hear
Yeah,
from you if you have any experiences on how you have been able
yeah,
to give feedback to the community. So they have generated all this data and all that. Technical reports are done by consultants or our staff and
yeah,
in English, for instance. How do we translate it back to the community? And
yeah.
then probably you could also touch the issue of sustainability of the activities that you're doing.
Yeah. So
Yeah.
I think the short answer is for the feedback to communities is it's still really only verbal, and
Uh-huh.
as we know, sometimes it's difficult. Government want to see high quality reports upon which they can make decisions. So you're right. It's that, for example, in DRC, they've successfully got an increase in the budget in Katanga province, but that was done on the back of a lot of work with the community, but also a consultant did a report to government, which then
Uh-huh.
prompted the government to say, hang on, what's going on here? Because we have another report that says the opposite from our own officials. And then that prompted the government officials to go and visit the community directly and hear from the community directly. So that sort of gives an example of how it's happening. But I agree with you. It's very this how you share information, the ownership of the information, the way it's transmitted is very problematic. And I don't have an answer. But one thing about trying to aggregate the information and share it back to community and give community access. All of these issues around literacy and education and representation skills come up, but at least we're trying, and I think there's a lot of momentum in the data space. So looking more broadly at agencies and organisations and NGOs that are really active in data, this is becoming a very hot topic. So there's a lot of thinking going on that I'm not privy to, but one of our partners is, and um, I can connect you with Rob at some point if you're interested to follow up further. But I'll also share through Sarah, we have a flyer on Everyone Counts Just Completed that gives information about the process. Um, Now, what was the other question? Oh, sustainability. That's a big issue too, because what we find is that the facilitators, I mean, the bottom line is we know in all our for all of our community volunteers, as with CVA, as with other programming, is they need a bit of support. So they need maybe access to a bicycle or a stipend for transport, or a meal every now and then. And how we do that is not very clear. I've thought that, and I'd love some feedback, but I've thought that we should be looking at, um, cash transfers are working very effectively in the humanitarian space. How do we link cash transfers in as a way of promoting voluntary work in countries where people want to volunteer, but we all know the evidence is that it takes them away from their day-to-day job. They're not very well off, and they can't, they have to pick, do I volunteer or do I earn money? And we know in a developing country what the decision has to be. So how can we explore the use of cash transfers to support volunteering rates and greater sustainability in terms of maybe modelling to government the value of volunteers working in this space so that it can be institutionalised, and that comes back to the sustainability. So, for example, in Indonesia, the government in Indonesia have a very big program that does have facilitators around these types of processes. So how are they paying those facilitators? What's the institutionalization of this work? I hope that helps. If not, doesn't really suggest that we're actually yet addressing this sustainability question, and I'm really glad you raised it. But one point I would make is that we've been working with our village health committees forever, because that's what we do in development. And the evidence we have from CVA is those committees are much more functional through the CVA process. I think because it gives them a very simple tool and way to hold governments to account, way to involve communities. It helps them to be functional. So that's an element of sustainability that we can argue for. But in the long run, it's how these local governance mechanisms, how are they made more part of the system by government itself? How are they institutionalised so that they're doing these things that we really shouldn't have to do, that it's actually a more of a functioning governance system. And I think that I'm going to have to run shortly, Sarah, because I've got this Indian issue. But
yeah, no, totally fine. As I said, me too. I'm working on my own India issue. All right, but I appreciate your time for running through this and we will do this again in about, what is it, 7 hours when Africa is awake.
Yeah. And right. Thanks so much for coming.
Yeah, thanks so much, Chris. Always a pleasure. All right, run, go get your visa. I'm not far behind you. I'm trying to get mine off using the e-visa process. And then just hit a small snafu.
They're very bureaucratic, the Indians, that's for sure. Even their contracting firms, their private contracting firms are bureaucratic.
Oh, man. And they asked me to put down all the countries I've traveled to in the last 10 years, and I filled up the available space.
Oh! Oh, my goodness. Okay.
I know. So get ready.
Thank you. Thanks, Chris. See you again later today, Sarah.
See you in a few hours. Thanks, Sue. Thanks, Chris.
Bye.
Bye.